Hello, everyone. How are you? We're going to get started here. Thank you so much for joining us today. I'm going to take my glasses off so you can see my eyes because we have a lot to talk about today. How are you doing? I'm Erica M. And I am always so excited to host these events where I get to bring you some really great, juicy information and help you make your parenting decisions. So tonight's discussion is about preparing your kids for the COVID-19 vaccine. And really, it's a discussion, but it really is a Q&A. So listen, I know that these are really challenging times on so many levels. If you're a parent, then you are probably physically and emotionally exhausted. The pandemic has made everything more challenging. And there is one thing that I know for sure. Top of every parent's list right now is our family's health and making decisions that are in the best interest of keeping our kids safe. The COVID-19 vaccine it's raising a lot of questions amongst parents. And this is a safe space. And it's a place where you're going to get trusted resources to get the information that you need to make the best decision for your family. I have some spectacular women joining me tonight who are here to help answer your questions and share their knowledge about vaccines and fear of needles. So let me bring everybody in right now. Of course, the technology is never easy. So I'm going to bring everyone in here and introduce everybody to you and them to you. So let me hello, everybody. Thank you for joining us here. And at the same time, it would be awesome for those of you who are joining us live on the YMC Facebook page to jump into the comments and tell us where you're watching from. Who's here? I'd love to know, so that way we can have a conversation with you. So jump in. Welcome to the Facebook Live here, and let me introduce you to my guest today. First, I have Dr. Katharine Smart. Katharine joins us from Whitehorse in the Yukon. She lives there. Dr. Katharine Smart is a 20-year pediatrician who works primarily with children who have experienced trauma and adverse childhood events. Prior to moving to Canada's North, she was a pediatric emergency medicine physician at the Alberta Children's Hospital in Calgary and the Royal Children's Hospital in Melbourne, Australia. And if that's not enough, Dr. Smart currently serves as the Canadian Medical Association President, the CMA, and she is one of only the 10th woman leading the CMA in 154 years. Wait, there's more. She's also a mom of 2 kids, not dogs, 2 kids. Do you have dogs?
1 dog, 2
1
kids.
dog. 2 kids. Okay. And then we're going to go from the Yukon. We're going to go all the way to the other side of the country and say hello to Dr. Christine Chambers, who is joining us from Halifax. Christine is a Canada Research Chair. She's a professor. She's a clinical psychologist who's known internationally for her research on children's health and pain management. In fact, she launched Solutions for Kids in Pain, also known amongst the hip kids as SKIP. And the mandate for SKIP is to help improve children's pain management. So if you see anything in social media with the hashtag, "It doesn't have to hurt," that's part of Christine's SKIP initiative. And if that's not enough, well, she's also a mom of 4. And speaking of moms, we're going to go back to the other side of the country and head over to Vancouver Island. Hello to Deb Balino. You may know Deb from social media. Her handle is Sass and Smalls. She is super cool. She's a mom of 2, and she is a self-admittedly exhausted mom, and she posts about her life being a stay-at-home mom and a homeschooling mom. and she is all about keeping it real, which is why I invited her here tonight, because that's the plan. Tonight, we are going to keep it real. And I also invited Deb here to share her experiences with vaccinations, as well as sharing her questions about the COVID-19 vaccine. And she also went out to her network of parents, and she has a slew of questions that she is going to pummel us with as well. And as well, we're going to be answering everybody who is joining us here today. So I want to say hi to everybody, not only on screen, but in the comments. Yolanda, thank you so much. And Katharine is here. Dwayne, Solutions for Kids is here. So this is fantastic. We are, more people jumping in. I see Yolanda has a lot of great questions. So Yolanda, I'm going to ask your last question in just a few minutes, okay? Stick with me because that is a really important question. Okay, I also want to tell you a few things. This conversation is really about answering your questions, as I said. So if you have any friends, any parents who have questions about getting their kids vaccinated, specifically the 5 to 11-year-olds, you can tag them right now into the comments and invite them to come and join this conversation. This will get archived, so they will be able to see it at another time. But if they would like to jump in and ask their own questions and listen to this conversation live, they're welcome to. Just jump into the comments. As well, I want to thank the people from SKIP who are here, and also our other partner, Children's Healthcare Canada, for joining us online and being part of our conversation. So first of all, I want to ask my amazing crew of professional thinkers, if you could tell me your situation at home as a parent, first of all. Dr. Smart, Katharine, are your kids vaccinated yet?
Yeah, thanks for that question. So I have, as you said, 2 kids. I have a 13-year-old daughter who's fully vaccinated. She was able to get vaccinated in June. And I have an 11-year-old son who's been anxiously awaiting his turn. Vaccinations for kids in the Yukon started this week, and he is booked for Monday. So he is soon to be vaccinated.
Okay. Christine, you have 4 kids. What's the situation there with vaccines for you?
Yeah, similar to Katharine, I have a 13-year-old and a 15-year-old who were vaccinated over the summer, so they're fully vaccinated. And I was really pleased. Their younger siblings who are 10, they're 10-year-old twins, they were able to get their vaccinations last week, the first dose here in Nova Scotia. So really, really grateful. And they were feeling a little left out, so they're really happy to have had the chance now.
Great. And over to our homeschooling mom, Deb. What's the situation with your kids? Are they vaccinated?
No, they are not. I have a 10-year-old and I have a 3-year-old. And my husband and I are both vaccinated. My parents, who I'm also the caregiver of, or I support my parents as well, they're also vaccinated. The house is vaccinated, but the kids are not. We just registered our daughter, and she is scheduled for this weekend.
Okay, so we have a mix of vaccination, but I think it's safe to say that my kids are both vaccinated. They're older. So you're talking to people who do believe in the importance of vaccines. However, there are a lot of people hopefully joining us tonight who are uncomfortable with the vaccine, who have questions about it. And I think that's fantastic, because you need to be comfortable doing something. Here we go. Yolanda has a question, which I'm going to throw in. First of all, Katharine, you can look in the comments, but basically she says that essentially, I'm trying to synthesize it. I think that what she's trying to say is COVID is not that dangerous for kids. So why the heck would I vaccinate my kid? Like, I'm talking a 5 to 11-year-old. Mm-hmm. I believe that the outcomes for kids who are getting COVID are not that serious. So why would a parent want to get their kid vaccinated? Yolanda, tell me if I didn't ask it properly, but I think that's what you were trying to say.
Awesome. I think that is such a great question. And honestly, I think it's probably one of the main questions that's on the minds of parents of that age group, right? It's been really reassuring that children have rarely been really sick from COVID. And I have to tell you that in the summer, as we were entering this wave with Delta and seeing what was happening in the United States, I was really quite worried that it was going to be a lot worse than it's ended up being here, because the numbers in the US have actually been a lot worse than what we've seen in Canada. So I'm grateful that that hasn't been the case. I can give you just a few numbers to kind of situate what we've seen in Canada. We've had about 0.2% of kids who have gotten COVID have ended up in hospital. So as of December 3rd, there was just over 1,000 children in that age group of 0 to 11 that have ended up in hospital across the country. Of those, 136 have needed critical care, meaning an ICU. So those are kids that had life-threatening sort of things going on with COVID. And there's been 8 children from 0 to 11 that have died that's been attributed to COVID. So that's sort of where we stand. So certainly not to minimize those bad outcomes, you know, because having your child hospitalized or in ICU, and of course, death of any child, is really awful, but it's certainly not been something that's been overwhelming our hospitals, which is great. But I think what's really important when we're thinking about COVID in kids is recognizing the impacts beyond just the acute illness of COVID, right? So it's true for most kids, they're COVID positive, it's going to be a self-limited mild illness. There's going to be other kids though who do get sick, and you can see that in the numbers. But COVID has a lot of impacts on children beyond just that. So I kind of put them in sort of 2 categories. One's the medical piece. You know, what else can happen from COVID beyond just the infection itself? And there's really 2 big things in that category. One is long COVID, which is ongoing symptoms of COVID past what would be typical for a viral illness. And there's different numbers that we're seeing. This is obviously ongoing research because it's a new condition. But I think most experts are landing on thinking it's going to be about 3 to 5% of kids will experience some form of long COVID. And that can range from milder impacts where it's just like that cold that doesn't get better and you're coughing for a few months, up to kids having ongoing neurological symptoms, meaning brain symptoms, things like fatigue, brain fog, not really being able to get back to their normal level of activity. So it can be quite debilitating. And what's really hard to know is it's impossible to predict who those kids are. But we're talking about 3 to 5 out of 100 kids infected. So it's actually quite significant. So that worries me. The other kind of medical piece to COVID is this post-COVID inflammatory syndrome, which is called MISC, or multi-system inflammatory condition. And what that is that's children whose immune systems have had a reaction to being exposed to COVID that then weeks later show up at the hospital with an overwhelming inflammatory response where their bodies are experiencing a lot of inflammation, and that's impacting their brains, their lungs, their hearts, other organ systems. That's happening in about 1 in every 3,500 kids infected. So it's also not really that rare. And if you talk to pediatricians or people working in children's hospitals, they've actually been seeing a lot more of those types of issues than really sick kids from COVID directly. So there are some medical impacts for sure from COVID. Equally, and if not more, oh, sorry, go ahead, Erica.
Well, so what happens is some kids are not showing any symptoms of having COVID, and then they're showing up in hospitals later. Is that what you're saying?
Yes, absolutely. So what we know is this long COVID and this MISC are not necessarily related to how significant your experience with COVID was directly. So some of those kids might have had like a mild cold, and then boom, this happens later. Some of them may have even been asymptomatic, where you maybe didn't know that they had COVID, and it's only showing up later when they have these complications later on. Mm-hmm. So, I guess the point is, your child doesn't have to be one of the kids who actually ended up in the hospital or sick from COVID to have these other medical complications.
Okay. Now, yeah. I'm wondering, for me, I don't know the science, but I would assume also that if your kids aren't vaccinated, and they would bring it home. And then if there's people in the home or in the community who are at risk, then they can pass it on. Is that sort of one of the things why we want to vaccinate our children?
Yeah, absolutely. And I think that kind of falls into that kind of other category of what the impacts of COVID are. So as you alluded to, one is absolutely the impact on families and the risk of spreading within the family, especially if you have any vulnerable adults in your family. So really, as we're seeing with Delta, any age of person can get really sick. But still, like with the original strains of COVID, anyone who's immunocompromised or anybody who's older, so grandparents, are particularly at risk. So that's, of course, a concern. And then I think that what that really leads to is sort of those social impacts of COVID, right? We are seeing a really increasing rate of mental illness among kids. And that's been related to a lot of the social aspects, the lockdowns in our communities, not being able to go to school, ongoing anxiety about getting COVID or giving it to someone they care about, limited opportunities for socializing because of just that risk of having your bubble too big, so not as many opportunities. And then ongoing, needs to quarantine if there's been an exposure in school. So all those sort of social pieces are really substantial. There's also been a lot of children who have lost a caregiver or a loved one to COVID. And that's obviously a life-changing experience as well. So part of controlling community transmission of COVID is bringing the numbers down in the population as a whole. And now that we can vaccinate kids 5 to 11, it's really one step closer to that. But I think it's really important for people to understand that's not necessarily the main reason to vaccinate your child. There's still a lot of direct health benefits for them as well. But it is also for sure one of the secondary benefits is that community impact.
I have another question, which is referring to the fact that every day in the news, something new shows up. Yesterday it was Delta, tomorrow it's Omicron. I mean, like it's this sort of whack-a-mole where we don't really know what's going to happen tomorrow. So I think a lot of parents are concerned because things are changing so quickly. So how do we know that if what is good today will still be good tomorrow?
Yeah, another great question. I think, one of the hardest things about this pandemic has been, we're all done with COVID, but COVID's not done with us, right? Like, who's not totally over this whole situation? Like everybody, but it's an infectious disease and it is changing, and we've never had a pandemic in modern times before. So we also have this like incredible amount of information, more than we've ever had when something like this has happened in the past. So, it isn't, I don't think, surprising to anyone in science that this keeps changing, but I can totally appreciate for people watching this evolve, they must feel like, what is going on? Why don't you guys have all the answers? The bottom line is the science is moving rapidly. There is all sorts of experts, highly monitoring this day to day. And a lot of these things we are finding out over time. So the Omicron variant's a great example of that, right? We still don't know exactly what it means in a highly vaccinated population like we have in Canada. We know it spreads quickly. We know that it does seem to be infecting people that have already had COVID before. It does look like the early data showing that our vaccines likely will still protect against severe illness and death, but they may not protect as much between getting infected, although that's not yet clear. So, this is part of the anxiety and the stress, I think, is what can we do? So I think what I kind of fall back on is I try to sort of stay focused on the things we know. We know that the public health strategies we've been using will be useful for any variant of COVID. And that's the basic stuff, right? Keeping your social circles, as limited as reasonable, wearing a good fitting mask, being in spaces that are well ventilated, and being vaccinated. Like those things are still going to be useful. So I think it helps to kind of focus on what we know. And for myself personally, I've just decided I'm not going to get like too anxious about all the unknowns, because I just know it's going to change day to day. But I know those core principles are likely going to keep me and my family safe. So that's what I sort of focus my energy on.
So as we're talking, I know that there are some people who are in the comments they're really worried. They're throwing all kinds of statistics. I can't get to all the statistics. I don't know where they're pulling the statistics from, but they're very passionate about this. And I'm wondering, for you as a medical doctor, specifically as the president of the CMA, I'm guessing that you have had to study sort of the history of these sort of sociological experiences of reactions to vaccines. So could you tell me, in the days of polio and smallpox, have parents always been afraid of vaccinating their kids? What is the same or different to today?
Yeah, that's a great question. I think what's different today than in the past. And I can just speak generally about my experience with vaccination as a pediatrician for parents that have had questions and concerns about vaccination is, in the modern times, most parents have not had the experience of having a child die or be critically ill from an infectious disease. That is very rare currently. Some parents will have had that experience, but it is uncommon. Before vaccinations, many children died before the age of 5 years old, and that's still a global phenomenon where many children lose their lives, 1 in 10 children, if you look at global statistics, to preventable diseases. We don't see that in our world anymore because of vaccination, because of sanitation, because of, people not living in abject poverty and the type of things that we see in other settings. So I think for a lot of parents, given that has changed, their sense of what the risk is has also shifted. So I think sometimes people worry a lot more about that active decision to vaccinate than they worry about not doing anything. Because also psychologically, right, we always worry a bit more about doing something than choosing not to act, if that kind of makes sense. So I think the choice of vaccinating feels very active. The choice of not vaccinating feels kind of like, okay, I didn't make a decision, or I didn't have to make an active decision, so it can feel a little bit more comfortable. And I think it's really normal for parents to be unsure, right? You're doing something to your child, and you're anxious that what if that's the wrong decision? So I think that's people sit with that and it worries them. And I think that's very understandable. I think the other real challenge that we have right now is a couple of things. I think one, we have access to information like we've never had in the past. So people can go and find all sorts of information themselves. So they're not as reliant on experts, I'm going to say, necessarily to give information to them. And that's wonderful in many ways. But of course, it also creates challenges. And as we've seen with COVID, the challenge has been there has been a ton of misinformation that's been spread about COVID itself, about vaccinations. And it's spread by highly organized people who are able to package it and make it look like science. And it's sometimes hard for people to differentiate those things. And that, of course, drives anxiety for people when they're reading that, which is very understandable. And I think just as a culture, we maybe aren't as trusting in, experts or authority as we've been in the past. And again, that there's good and bad to that, right? I think it's great that people have questions. I think there's lots of examples historically where people in authority have done bad things to people. So certainly don't think we should blindly trust everybody. I think it's great that people have questions, but I think there's just that cultural difference has made it really hard for some parents to know who to trust and what information is reliable. And that's, I think, why we're doing these things like tonight, right, is to try to have these conversations.
And I know that there is an initiative called Immunizing Children with Confidence that's being led by Children's Healthcare Canada and SCIP. So I wonder, Christine, can you tell us a little bit about this initiative? Because again, this is a place where parents can go and find all kinds of information and do some research. And we're going to put that information in a link to the website. So whoever is joining us today can sort of like it. You don't have to like it, but press something like, so you can bookmark it and go and read some of that stuff and find information. And I know there's been a lot of facts being thrown out again in the comments, which is fantastic. These will be some more that you can pull from. So just check the YMC. Katharine is running our YMC handle today, and she's going to throw that link into the comments. So Christine, can you tell us a little bit about that?
Yeah, so this is a wonderful initiative being led by our colleagues at Children's Healthcare Canada, Immunizing Children with Confidence. And it's actually mostly geared towards health professionals, but I think there is a lot of great information there for parents. You can go to the Children's Healthcare Canada website. They have a resource hub. They have information and summaries. I know Katharine is part of their advisory panel for this. They're going to be having a pop-up event in September. And really the goal is, just to connect people with the right information. Because I think what Katharine described is, we have access to so much as parents now, and it can be very confusing. You go to government websites and you think you might understand what the numbers mean, but you're not getting that context. And so I think that the important, a message for parents is really around look who you're getting your information from. Look to who the experts are. People like Katharine, like myself, who really have developed a lot of expertise. And it's interesting, I'm noticing in the chat, people saying, well, this vaccine didn't take as long as other vaccines. And, it's so interesting, right, about how science works. And I'm a scientist. I spend all of my time, doing research and funding health research. And, no shortcuts were taken with this vaccine and its development. And it's actually based on decades of science that inform the technology, the process for, conducting clinical research on vaccines, approvals. All of that followed the same timelines, the same kinds of approval processes. So I think part of it too is maybe we as scientists haven't done as good a job as we could around really making clear how science works. And I think we're seeing a lot of that play out in the pandemic.
So, Christine, I'm glad that you're talking right now, because my next sort of topic of conversation is geared towards you, because you have spent many years working with kids and understanding needles, fear and pain connected to the fear connected to needle pain, and that it's actually very traumatic for a lot of not just kids, parents as well. And the reason why I want to talk about it today is because a lot of parents aren't getting their kids vaccinated because the kids refuse, they're afraid, or the parents have a fear of needles, so they don't want their kids to experience it. Can you tell me a little bit about the importance of being proactive when it comes to managing pain and fear of needles?
Yeah, I'm so glad you raised this, because I think this is a topic we don't talk enough about. And, there's a lot of complex reasons why people are vaccine hesitant. And, some of them there aren't easy solutions for. But pain and fear of needles is a big reason why, a lot of kids and parents avoid getting needles or postpone it. And it's something we have tons of research in support of. So we really work hard with parents to help them develop plans to make sure that they're prepared to distract their child. It could be as simple as, bringing your iPhone, having a YouTube video ready to play, teaching your child how to relax before a needle, making sure that they loosen their body muscles and that they take some deep breaths. There's even a numbing cream that you can purchase at your local pharmacy that you can apply to the skin, like, an hour before the procedure. A pharmacist can tell you where to put it. So these are some of the tricks that a lot of parents aren't aware of. And, even how parents manage their own anxiety during medical procedures like vaccinations can have a huge impact on kids. So that's a big focus for us at Solutions for Kids in Pain, is making sure that parents are aware that there are simple things that they can do to manage pain. There are, however, a group of kids who develop what we call like a full-blown needle phobia. And for those children, sometimes they need a more specialized type of support, specifically around the phobia, often from a registered psychologist, to help them overcome that phobia. But the reality is there's a lot that you can do in advance to help prepare your child. And you should also not be afraid to ask for accommodations. It's been wonderful seeing, different vaccine clinics kind of marketed specifically towards children with special needs or children with needle fears. And I know when I took my kids to the local children's hospital, they made it such a positive experience. They were each congratulated as they left, and they really felt fantastic when they were going because of this 2-dose vaccine schedule. It's really important that we give kids a positive experience the first time so that it's easier for everyone the second time.
And that's where I'm going to go right to Deb, because Deb has kids who have a needle fear, and you have been using some of these techniques. So Deb, I'd love to hear a little bit more about your kids and their reaction to needles, and then how you've been dealing with it.
So yes, I have the 10-year-old girl who for the last 9 years has been just so paralyzed by the idea of getting a needle. And that's with all the scheduled vaccines that we've been having to adhere to, flu vaccine, and any of the shots she has to get at the hospital. She has an underlying medical condition. It's kind of her story to share, so I don't really go into much detail about that. But she does have a a medical condition that requires her to get, seen at the hospital and tested with a full-blown, blood test. So needles are a big part of our life, and for me to avoid it, it's just ludicrous. I can't avoid it, right? It's just part of what our life is. So at this point, I have just been implementing some of the strategies, especially from Skip, Dr. Chambers. I'm just so appreciative because we are so much more equipped to go into these appointments. And like Erica said, and like Dr. Chambers said, there are so many accommodations for kids that have these sensory challenges and have these fears. We don't have to go to an open clinic anymore. I'm talking about certain vaccines. The COVID vaccine, I do want to ask you a question regarding that. But in our experience, we were actually kicked out of clinics. Because it was just so scary and loud and crazy. And even in a private clinic, my daughter, kicked and screamed, and, we almost, toppled over a glass sliding door. It's very traumatic for her, for me. And most parents would say, well, then why would you vaccinate, right? Why would you do this to her every year, and of course with the flu vaccine, that's definitely a choice. We don't have to do it every year. The reason why, like I said, is we can't avoid the needle. It's going to be part of her life for goodness knows how long, but it'll be part of her life. And so we can't avoid it. So all we can do is comfort her and distract her and implement all the things that are made available to us. Unfortunately, I didn't know about numbing creams until about 3 years ago. And by then she's already had these anxieties. And so even seeing a clinic, freaks her out, right? So before we even put the patch on, before, when they take it off, the actual removal of it, I'm not going to lie, that's also difficult for her, right? Or was. But we just kept at it. We kept going. We kept trying, the distraction, YouTube videos. This year I put an advent calendar. I literally showed the kids, advent calendar, first we do this, then we get this. Super excited. By the time I finished my sentence, the shot was done. And it took 3 years. But finally this year, she was like, oh, it doesn't hurt, but again, I had to keep doing it. We had to do it every year. Another thing that we've had to do is determine the fact that one of us, between my spouse and I, my husband and I, is the more calm one, right? And so my husband has been assigned to be the annual, needle man, and he brings my daughter. I get the toddler. So shockingly, he has never felt pain from the needle because he is 3, and we have, from the day he's had to get a needle and be aware of it, we've used the numbing cream on him, and so he doesn't even associate needle pain with needles. Wow. It just is. It's just a place where you get a free video and a candy. That's what he thinks. Sorry, Erica.
It's okay. Catherine, who is in our chat, said that her son has autism and he does not like needles. So she called Peel Health, and the paramedics came over to her house. They were very nice and understanding, and they managed to inject the vaccine shots to her son in their home. That's really, what a great story that is. Very, very nice. So let me ask you, Deb, since you are so articulate, you also have quite a large following on social media, and you mentioned that you were going to be here with us today, and you got a slew of questions, a slew. And so I would love for you to throw a few questions over to Dr. Smart or Dr. Chambers, and then we'll jump back into the comments again and see there's more questions coming in, but I know you've got some great questions there. So if you want to throw some over, that would be great.
All right. Well, I guess I want to start with, I'm not sure if you had mentioned this earlier, but are you able to show us the current numbers of the COVID cases among kids in this age range?
Yes. So I looked updated on December 3rd, and I can tell you there's been 197,000 children in Canada that have gotten COVID since the beginning of the pandemic. And what's changing over the last few weeks and months, I would say, is the percentage of the total population that's getting infected day to day is really growing rapidly in this age group. So when you look now at most provinces, about 25 to 30% of their daily cases are kids 5 to 11. And that's not surprising. Delta is highly transmissible. It's incredibly infectious. It's very similar to chicken pox. I'm sure we all remember like the chicken pox parties. You'd go and everyone would get it. That's sort of Delta. So it's been mitigated for sure by some of the public health strategies that we have in place. But because that group of kids is not yet vaccinated, it's experiencing this really burgeoning growth. And that's, I think, kind of what we thought was going to happen. And that's what we're seeing. I imagine that will start to change in a few months once kids are vaccinated. And if you look at the modeling in Ontario, they've sort of been able to show that as we get that group vaccinated, we're going to see that curve start bending down. But right now, it's the biggest group of kids impacted, or of people actually impacted.
I saw in social media, I saw a little sort of diagram, and there's like a hockey stick of the number of kids who are just recently getting infected with COVID. And so that's another thing to consider just in terms of keeping schools open. I know that I want kids to be able to stay in school. And do you think that schools will be able to stay open if kids don't get vaccinated? I don't know the answer to that.
No, it's a good question. And I would say, in terms of schools staying open, vaccination is one part of it. Again, I think what's really important to understand about COVID in children and adults, really in anybody, is there's no magic bullet here, right? There's not one thing that protects you 100%. It's like Swiss cheese. It's layering all the things together for the protection that's really important. And I think of like vaccination's the foundation of that approach, right? It's going to give you the best protection. It's also going to protect you against severe illness and death, and make your risk of actually getting COVID much less. It's about 6 times less likely if you're vaccinated versus unvaccinated of getting infected. But then, of course, the other things layer on top of that: wearing your mask, limiting your social exposures, social distancing, being in spaces that are well ventilated. So schools need to be looking at all of that as well to try to keep schools open. But there's no question that kids being in school is so important. And I think so many of those impacts we talked about earlier in terms of bad mental health and worsening mental health outcomes for kids were related to schools being closed. So I think everything that we can do to keep kids in school is really, really important.
Okay, Deb, do you have another question?
I do. Could you tell us a little more about the components of the vaccine that the kids will be getting in comparison to the Pfizer adult dose?
Oh, that's such a good
for
question.
Sure. So, great question. So the vaccine right now that's approved by Health Canada for children, and it's fully approved. So it's not experimental. That's something some people are worried about. So it has full approval. It's the Pfizer vaccine, which is an mRNA vaccine. And the difference for kids 5 to 11 versus 12 and up is the dose. So the adult dose and the adolescent dose is 30 micrograms of RNA, and the dose for children is 10 micrograms. So it's a third of the amount. The studies that were done compared that dose and saw it had a similar immune response, or an equivalent immune response, as what we saw in adults with the 30 micrograms.
So how do they figure out the dosing? Because kids 5 to 11 are different weights, they're different heights, they're different developmental stages. Like, how do they figure that out?
Yeah, it's a great question. And that's another thing some parents have wondered about, particularly if they have a child who's on the cusp of 12, or say like a 10 or an 11-year-old who's like a big kid, right? Like tall, or, obviously there's a big range, like you said. The bottom line with immunizations is they're different than other drugs. They're not weight-based. So, I think a lot of us are used to in our children, if you get an antibiotic, you're giving them Tylenol or Advil, you're always basing the amount on their weight. So that's like a pretty familiar concept. Vaccines don't work like that. They're just priming your immune system. So it doesn't really matter how much you weigh. So what they did is what they were able to show in younger kids is kids had the exact same, or, as robust of an immune response with that lower dose as adults or older children had with a higher dose. And they actually had somewhat less side effects, right? Because of course, a lot of the side effects you see from vaccination are actually your immune system reacting to the dose. So what you're trying to find as the scientist is that balance between a dose that's going to get you an adequate or robust immune response, but not so high that you're such an immune response that you're now getting really significant side effects.
Mm-hmm.
So they've sort of found for kids, I think that 10 micrograms was that sweet spot where they had the good immune response, or similar to what we saw with the higher dose, but actually slightly less side effects than what we saw in adults. So the similar side effects, fever, feeling tired, some headache, but at lower rates than what we were seeing in adults. And I think importantly, one of the biggest concerns parents have had is myocarditis, because we were seeing that in teens and young adults, primarily boys. So of course people were worried, what about this age group? And that's of course concerning. It sounds pretty scary. But what's been reassuring is there's now been almost 5 million doses given in the United States, and almost 1 million kids have had both doses of the vaccine in the 5 to 11 age group, and there hasn't been any case reports of myocarditis. So that speaks to the importance of post-vaccine surveillance, because of course, studies are not going to have hundreds of thousands of people in them. It's not practical. So there's always that worry about rare side effects that we didn't maybe pick up in the original studies just because of the numbers. And that's why we have really robust ways of monitoring for adverse events from vaccines when they get rolled out on a big level like that. So now we've really got this huge number of children who've been vaccinated in this age group, and we're not seeing any concerning new safety signals. So nothing unexpected has happened. So that's really also from my perspective, very reassuring.
Kelly is asking, what is myocarditis?
Yeah, great question. So myocarditis is inflammation of the heart. So what we saw, where this came up, was in teenagers, primarily boys, although it did happen in some girls, but a much higher rate in boys, more common in older boys and young men. Some of them had myocarditis, or inflammation of their heart. That's where the muscles inflamed, or pericarditis. Pericarditis, there's a sac or a membrane around your heart that can also get inflamed. And that also was one of the things that was seen. But I think there's a few things that are important to understand about that, because it sounds really, really scary. Almost all the cases were mild and self-limited, meaning it just got better on its own, or the most common treatment was Advil, or and what's called a non-steroidal anti-inflammatory, so an over-the-counter medication like you'd use for fever, treatment with that. Very few people needed hospitalization, and even fewer needed support in an ICU. So for the vast majority of people, this was a mild and self-limited problem. And the risk of getting myocarditis from COVID itself is almost 6 times higher than from the vaccine. And for youth and kids who got myocarditis from COVID, it was much more serious. Now, we've seen that more in the United States than we have in Canada in terms of myocarditis from COVID, but the risk is actually quite a bit higher just from the virus itself. So these things are all about risk, right? It's a bit of how you perceive risk, the risk of doing something versus nothing, the risk of the vaccine versus the virus itself. But I think it's important to know, even though it sounds scary, fortunately, it's been not as severe as it might sound. So that, to me, again, has been reassuring. And again, no cases in this age group, which wasn't unsurprising in that we rarely see myocarditis in kids 5 to 11. It's just not a common diagnosis in that age group. So we were expecting not to see it in this age group. But of course, there was no way to know for sure until millions of kids have been vaccinated. And that's now happened, and we're not seeing it. So it's looking like good news.
Dr. Smart, I'm sorry, Erica.
I'm just going to comment here. There was a question here from Heidi saying, can you share the source for the 1 million US 5 to 11 vaccine rollout so we can review that data? I wonder, is it possible? I don't think you would have that. I mean, you might have it. If you want, you can, post it into here at the end of that would be good. Why don't you do this at the end of the conversation? Dr. Smart, you can just respond and just throw it in the comments there so people can see the information. Is that okay?
Yeah, sure. With my setup, I can't see the comments, but I can tell you it's on the CDC website out of the United States, the Center for Disease Control. They're publishing their ongoing data around pediatric vaccines.
Yeah, so maybe
I can add it later.
No, we'll add it later. Yeah. So, because I think that's, it's fair. I mean, people are asking, this is the problem, right? Everybody is saying, this statistic and this statistic, and fair enough. Yeah. So that's why, Dr. Smart, that's why I think do it, share that information so people can read it.
Oh yeah, happy to do that.
I was
Okay.
just going to
For
ask
sure.
about a resource that you would recommend that parents can go to and that has understandable layman's terms, because there's just so much access to information now. It's social media and other people's opinions and TikTok. You know, that's a big one. If we could have a resource that's reliable that parents can turn to, that's frequently updated, that'd be wonderful. So I think that's a really good start.
Yes, and I can throw some links after into the chat as well for people. For sure, there's there's a few ones. You know, we talked earlier about the program Immunizing Children with Confidence through Children's Healthcare Canada. There's also another one called Max the Vax that's got some great online resources, and there's some excellent resources around answering a lot of these questions out of the pharmacy department at the University of Waterloo as well. So those are all really reliable sources. They're frequently updated. They have a lot of detailed information for people. So I can afterwards throw those into the chat for folks as well.
And we also have an article that you wrote for YMC, Katharine, which we're going to throw that into the comments right now with a lot of that information in there as well. So we're on it. We're on it.
Perfect.
I wanted to ask,
and I think that's so important, right? Like good online resources are really
absolutely.
important.
Yeah, I think that's part of the issue that parents have is we go back and forth. I would be lying if I didn't I'd be lying if I didn't say I was in the gray area of deciding whether I'm going to vaccinate my child or not. And sometimes you just need to get that accurate information from reliable sources and not just hearsay. So, you know, I really appreciate that, making that available to us. I want to ask you though, Dr. Smart, Leanne had a question specific to just going on with the concerns with myocarditis. So this is also for me as well, since my child has an underlying medical condition. She has a 10-year-old who has a heart condition. And so she has her concerns about that. So very close to the adolescent male age group. Should she be concerned with any sort of systemic side effects for her situation, for her son's situation? Same with me. You know, I'm always concerned about the uncertainties, right? That they've already been through so much physically and medically.
Oh, for sure. I think that's such a great question. And I think you're absolutely right. Like, especially for parents who have already had medical complexity with their children, have been through a lot of procedures or just uncertainty or scary things, like naturally you're going to just be that much more concerned. What if something goes wrong? So I would say this, you know, there hasn't been any evidence to suggest having underlying conditions makes you more at risk of a bad reaction to the vaccine. What we do know is having underlying conditions gives you a higher risk of having more severe COVID. So about 2 out of 3 kids who have been hospitalized or been sicker with COVID do have underlying conditions. A third don't. So it's, you know, it's not like you're no risk, but certainly kids that have medical problems are more likely to have a bad outcome with COVID or get sicker. So I think those are really kids that we want to be targeting with vaccine. There's no evidence that having had an underlying heart problem puts you at risk of myocarditis from the vaccine specifically. But I would definitely say, you know, if you're in that category, we have a child with a special condition or a significant medical condition and you're really not sure, absolutely ask your care providers, you know, ask your specialist, ask your pediatrician, ask your family doctor, because they're going to know your exact medical history. And I think they're in the best position to really reassure you about your individual situation. But at this point in time, there are no diseases or conditions or pre-existing conditions that have been published that are contraindications to being vaccinated. So that's not, there's no ones that we're really looking out for where we're saying, oh, you shouldn't get vaccinated. The only kind of reasons not to vaccinate would be if you had myocarditis or pericarditis from the first dose of vaccine, you should see a heart specialist and have a conversation about whether you should get the second dose and if so, what it should be. So that would be if that happened to you because of the vaccine, or if you had a significant allergic reaction to the first dose of vaccine, which we call anaphylaxis, you should see an allergy specialist and they should help guide your decision around the second dose. So there's nothing that you would really know about beforehand that would make you think you shouldn't do it.
Okay.
Are there any special considerations related to preparing for the vaccine for families with children with medical complexities or disabilities?
Maybe let Christine answer that, if that's okay. I'm happy to weigh in on it too, but I think I know this is her area of expertise, so happy for her to take that one.
Yeah, I mean, it's a great question, and it is often. I mean, Deb gave a good personal story of how challenging it can be if there's a history there. So, I think really, parents know what tends to work best for their children. So, really having a plan in advance, talking to the care team, finding out what's possible. Sometimes parents are afraid to ask if certain accommodations might be possible, but often it is possible. So, really kind of having a plan. There's a number of different resources we have on our Solutions for Kids in Pain website that can be helpful for families with different special needs. So, there's a lot that can be done. And often it just involves planning in advance, knowing your child, asking the care team what's possible.
Cool.
I want to weigh in. Lynn from Alberta, she had actually told me that some of the clinics that were over there, they actually handed out Play-Doh and activity books and fidget toys and therapy dogs. And I was so comforted by that. But truth be told, I also had Leslie here in BC mentioning that some of the clinics didn't have that. So comforted by that. But oh, I'm getting a little feedback. Sorry about that. So here in BC, parents are kind of nervous about going into these open concept clinics where the kids could potentially be traumatized by the pain that other kids are experiencing and the anxiety and all the stress. How do you recommend, Dr. Chambers, parents, handle that situation? Because we don't have the private rooms, that I know of anyway at our areas. There's something you can, for me, I'm going to bring noise cancellation ear. That's what they're for, right? So she's going to be wearing noise cancellation. I'm going to model it by wearing headphones myself because I want her to know this is normal. This is normal to be anxious, right?
Yeah, well, that's a great strategy. And there's lots of things you can do. And we know that vaccinations can be successfully delivered in a lot of different settings, including sort of group or school-based settings as well. So again, having a plan, preparing your child so they know what to expect. I love your noise canceling headset idea. It doesn't take a lot to distract a child. And actually, we also know that when children see other children having positive experiences with vaccination, it actually can be a really positive thing for them. So I think the focus is just really on making sure each experience is as positive as possible, emphasizing what goes well. There's some really fascinating research that shows that what children remember from one medical procedure impacts how much pain they have the next time. So really focusing on what went well and focusing on that positive experience for kids and families from the beginning, regardless of the setting.
Any other questions, Deb? These are fantastic questions.
I've got great women and parents asking them too. I wasn't able to provide the answer, so I said, tune in. We'll make sure you get your questions answered. I do have a question from Sarah. If a booster is actually necessary for this age group, and has that even been determined yet?
Yeah, great question. So I think, what's becoming clear for adults is this is a 3-dose vaccine series. So that's not surprising. A lot of vaccines we give are at least 3 doses, and lots of vaccines do get boosted over time, including a lot of the common childhood vaccines your child would have already had, right? They get that primary series when they're infants, then they get another set at 12 months, 18 months, school age, and then later in grade 6 and grade 9. So we have that experience already with vaccines, knowing they often need to be repeated over time to keep a robust immune response. And we're seeing with adults, and especially with the Omicron variant, it's looking like it's going to be more important to get that 3-dose series. Yeah. We haven't yet looked at that in children. So I think the answer is right now, we don't know for sure. I wouldn't be surprised if at some point we find out kids need that 3rd dose, but I don't know that yet. So I think that's something that's going to be monitored. And I think like a lot of the science that you're going to see, a lot of this is evolving in real time. It's being monitored by a lot of experts. It's something these are questions that people are asking regularly. And I think we'll know more in a few months. And I think a lot of that will depend on what happens with Omicron, if other variants show up, and how good these vaccines are against some of these newer strains of COVID. And that's kind of still to be determined.
And there's a question here that I want to ask, which a lot of people are concerned about, a particular ingredient in the Pfizer pediatric vaccine. I think it's called traumathamine.
Mm-hmm.
Yeah. what is it and why is it in the pediatric vaccine?
Yeah, great question. So what changed, one of the things that changed in the formulation of the pediatric vaccine versus the adult vaccine was the preservative, or the non-active part of the vaccine. And they changed it to this medication, or that's not a medication, but this component, for a couple of reasons. The main reason being it makes the vaccine much more stable at different temperatures. So you may have heard one of the big issues with the Pfizer vaccine originally was it had to be stored in extremely cold temperatures, like I forget exactly, but it was something like minus 60 Celsius. So what that meant is it needed special refrigeration, special freezers. The handling of it was very complicated, especially, when you're living somewhere like I am, and we have all these remote communities. How do you get this vaccine to these people living all over Canada in these small places when you need this very special refrigeration? And then once the vaccine was thawed, its life in the fridge was very limited. So it was, complicated to handle it. So of course, they've been looking at ways, how do we keep our technology, but make it less finicky to deal with? And by changing the preservative, they were able to get not this cold of storage temperatures, and the vaccine lasts longer in the fridge. So it's much easier to use. What this component is it's just a base, meaning, our bodies are acid and base. It's similar to something called THAM, which is something we actually use sometimes in neonatology when very sick babies, then they need some buffer or a base to balance out too much acid. That's what it is. So it's inactive. It's not medically active. It doesn't do anything to you. All it's doing is changing the way that we can handle the vaccine. So it's not concerning, and it's not actually biologically active in your body.
So Susie Smith is asking a question. I've heard reports out of the Alberta Children's Hospital of a higher rate of seizures and a sudden increase in type 1 diabetes diagnoses in kids who had COVID, but not the vaccine. Is there any known research currently correlating these two conditions post-COVID in 5 to 11-year-olds?
Great question. So I have not seen any published evidence linking a development of epilepsy or type 1 diabetes specifically to COVID. I can tell you with type 1 diabetes, we don't know 100% why kids get type 1 diabetes, but there is a school of thought that it may be a post-viral phenomenon. So that it may be this thing that we call molecular mimicry, meaning your immune system, when it makes antibodies to fight a virus, can also make antibodies that attack the pancreas because it gets confused. So it wouldn't be shocking to find out that an infection from COVID put you potentially at risk of type 1 diabetes later on, because we have that hypothesis about other viruses. But to my knowledge, that hasn't been researched, and I don't think we know that for certainty. But I think, again, because this is a novel virus that's infecting so many people so rapidly, some of these things are going to be things we better understand as more time goes by, because we haven't been in a situation really, again, in modern times where we've had a new virus that's infected, millions of people en masse over a short amount of time. So I think some of these things are going to be things that we understand better as more time passes. That's a really good question.
Okay, Deb, back to you.
I had a question about, because we're hearing two different, quite a discrepancy between the two resources. But as far as getting the second dose, is it recommended for kids to wait? NACI had actually suggested 8 weeks, 2 months. Mm-hmm. And then I believe it was Health Canada that recommended 3 weeks. So why is there such a discrepancy, and what should we be listening to as far as that's?
Yeah, good question. So what it was is the studies that were done on children had the 3-week or the 21-day interval, and that was what the manufacturer was recommending. NACI and Health Canada came out with the approval and the NACI guidelines at the same time. They recommended the 8-week interval, and there was two reasons for that. One is Canada was one of the first countries to actually go with the extended interval for adults, right? So if people remember back when we first started vaccinating people, which seems like a million years ago, but it was really not that long ago, there was a lot of shortage of vaccine. And there was this debate about, do we immunize the most vulnerable people, double dosing them within the 21 to 28 days, depending on the vaccine, or do we give a lot more people the first dose and delay the second dose? The NACI scientists decided that we would go with option 2. hit as many people as possible with the first dose and have a longer interval for the second dose. And the reason they decided that is based on what we know about other vaccines. They thought they would get better immune response with spreading out the interval. So it was sort of an educated guess, I guess you could say. And that has borne out to be true. So what we're seeing is in adults who had their doses stretched out, their immunity has actually lasted longer and has been better than people who got their first 2 doses of vaccine closer together. So they're extrapolating from that experience to children, saying, you know, we think if we spread the dose out to 8 weeks, we're more likely to get a longer lasting, better immune response that lasts longer. So that was the one reason. The second reason was, of course, myocarditis being this side effect that we were concerned about. There was some preliminary data, again, not a lot of data, but some data suggesting that the risk of that also might be less if the vaccines were spread further apart. So that was a secondary reason they thought, okay, if that's a side benefit, that would also be very good, because of course we want to avoid any side effects as much as we can. Now, what's interesting is in the US, they've gone with the 21-day interval, and they aren't seeing myocarditis in this group, as I said before. So that maybe hasn't been as much of a concern in younger children. That might be a bigger concern in more adolescents. The 8-week interval, it doesn't have to be given at that. And some provinces are letting people choose if they want the 21-day or the 8 weeks. So it kind of depends where you live. But the rationale for it is really about trying to create as long-lasting of an immune response as possible. I think, again, with Omicron coming, I don't know if that might change. You may see them saying, and in certain communities too, if there's like a massive increase in cases, that recommendation may change. They may say, okay, things have changed a bit. We've reconsidered this now. We think it's better to get as many people both doses as fast as possible. Or we may see, no, this is still not really as concerning in kids. We still feel this is safe to wait. So I think, again, you know, this is science in real time, right? These things are happening, it's changing. And the scientists that make these decisions are monitoring the situation. And that's why sometimes the guidance changes. I think that's hard because it's confusing. But the reality is, you know, this is a moving target. But that's the reason why that was the recommendation in terms of currently.
Believe it or not, we have been talking for an hour. Can you believe it? And I know, Deb, you have so many more questions, but we only are supposed to be live for 1 hour. I want to, first of all, say to all the people who have been commenting, in putting their statistics, etc., in the comments, we see it. And it's interesting. There's people who are saying those statistics are not accurate, etc. Show me your numbers. So, Dr. Smart, the few people who have asked for your numbers, you're going to throw them in so people can do their research and make informed decisions. And hopefully we will end this goddamn pandemic
Yes.
in the best that we as parents can, really. Yeah. So thank you all for joining us. Thank you to Skip and Children's Health Canada for making this conversation possible. Thank you to Deb Balino for going to all of your people and getting really fantastic questions from parents who really need to know some, complicated answers to complex questions.
Very big decision.
And Dr. Christine Chambers, thank you for spreading such useful information to parents about how to take care of our kids who are afraid of needles and afraid of needle pain. And these are valid psychological concerns that need to be addressed, because if we don't address them, then it can snowball to the point where I have a friend who wouldn't get an epidural because she was so afraid of needles. And that's not a good situation for anyone who is afraid to get a needle if they're ill, right? So again, in the comments, we put the article on some of the things you can do to help with needle pain and the fear of needles. And thank you to Skip for all the amazing work that you're doing on behalf of parents. And last but not least, we put you through the ringer tonight, Dr. Katharine Smart. Thank you so much for putting up with all of our, pretty pointed questions and for having great answers. I know that physicians and the medical community is having a really hard time trying to give fair and balanced information amidst these, very valid questions from all of us who are, unsure of the kinds of decisions to make. So thank you for being very candid and having a brain full of amazing information about the health of our families and to keep our families and our Canadians safe. So thank you all, and thank you to the parents for joining in and for listening for the last hour. This is a lot of information to take in. Hopefully you found a lot of useful information. And of course, this is going to be archived on the website or on the Facebook page. So you can come and look at it again and check for any information. So again, thank you all and very, very much. And we will do this again and continue the conversation. Good night, everyone.
Good night.
Thank you so much.
Thank you.
You're so welcome. Bye.
Bye.
Bye.